1. A 62-year-old female presents with a painless, exophytic growth on the lateral border of her tongue. She has a history of heavy alcohol consumption. Which feature is most indicative of malignancy in an oral lesion? A. Pain. B. Ulceration. C. Induration. D. Erythema. E. Bleeding. Answer C. Induration. 2. A 55-year-old man presents with a non-healing ulcer on his lower lip. He has a history of tobacco chewing. What is the most common type of oral cancer associated with tobacco chewing? A. Basal cell carcinoma. B. Adenocarcinoma. C. Squamous cell carcinoma. D. Melanoma. E. Lymphoma. Answer C. Squamous cell carcinoma. 3. A 50-year-old male presents with a persistent lump on his buccal mucosa. He has a history of chewing tobacco for 20 years. What is the most effective preventive measure for this condition? A. Regular dental checkups. B. Use of mouthwash. C. Quitting tobacco use. D. Increased fruit and vegetable intake. E. Vitamin supplementation. Answer C. Quitting tobacco use. 4. A 68-year-old woman presents with a lesion on the floor of her mouth that has been present for several months. Biopsy confirms squamous cell carcinoma. Which of the following is a common metastatic site for oral squamous cell carcinoma? A. Brain. B. Lungs. C. Bones. D. Liver. E. Lymph nodes. Answer E. Lymph nodes. 5. A 57-year-old male presents with difficulty swallowing and a mass at the base of his tongue. He has a significant history of smoking and alcohol use. Which imaging modality is most useful for evaluating the extent of oral cavity cancers? A. X-ray. B. CT scan. C. MRI-D ultrasound. E. PET scan. Answer C. MRI. 6. A 49-year-old female presents with a non-healing sore on her gingiva. She has a history of HPV infection. Which strain of HPV is most commonly associated with oral cancers? A. HPV-6. B. HPV-11. C. HPV-16. D. HPV-18. E. HPV-31. Answer C. HPV-16. 7. A 65-year-old man presents with a mass on his tongue that has been growing over the past few months. He has a history of heavy alcohol use. Question: what is the role of radiotherapy in the treatment of oral squamous cell carcinoma? A. Primary treatment. B. Adjuvant therapy. C. Palliative care only. D. Preoperative therapy. E. Not used. Answer B. Adjuvant therapy. 8. A 70-year-old male with a history of smoking and alcohol use presents with a growth on his tongue. Biopsy reveals squamous cell carcinoma. What is the 5-year survival rate for localized oral squamous cell carcinoma? A. 20%. B. 40%. C. 60%. D. 80%. E. 100%. Answer D. 80%. 9. A 59-year-old female presents with a persistent red patch on her gingiva. She has a history of smoking. Question: which clinical feature distinguishes erythroplakia from other oral lesions? A. Painful ulceration. B. White patch. C. Mixed red and white areas. D. Red velvety area. E. Firm mass. Answer D. Red velvety area. 10. A 67-year-old male presents with a non-healing ulcer on his tongue. He has a significant smoking history. Question: what is the significance of the TNM staging system in oral cancer? A. Determines histological type. B. Guides treatment options. C. Identifies genetic mutations. D. Assesses pain severity. E. Predicts risk of recurrence. Answer B. Guides treatment options.